Hello, Professor Tilka. As a group, we've made a presentation on neuromuscular disorders, in particular multiple sclerosis and Guillain-Barré syndrome. Participants are Brittany, Daniel, Karen, Kelly, Zach, and myself. I will start introducing both diseases with some interesting facts. Multiple sclerosis, MS, is a disease of the central nervous system. MS occurs as a result of an autoimmune response in genetically susceptible individuals. And although it's not clear, they suspect the protein in the CNS might be the culprit of this disease. Chronic demyelination of the myelin sheaths covering systems such as the brain, the optic nerve, and the spinal cord is present. Approximately 400,000 people in the US have MS, and women are twice as much affected than men. Prevalence is greater in colder northern latitude states like Northern Atlantic, Great Lake region, and Pacific Northwest. Guillain-Barré syndrome, GBS, is a disease of the peripheral nervous system. Immunological response is a possible cause for the demyelination. Demyelination of the myelin sheaths covering the axons of the peripheral nerves is present. It is the most common peripheral nerve system disorder. Guillain-Barré syndrome is caused by a rare and acute autoimmune disease. Men and women are affected in equal numbers, and also morbidity across all age ranges is equal. It affects about 2 people per 100,000 every year, and 40% of those patients affected do not have a specific precipitating event. Some of the risk factors for multiple sclerosis are heredity, gender, living in colder northern latitude states or countries, like I mentioned before, individuals with the human leukocytes antigen HLA-DR2 haplotype, although the reason for that is still unknown. When it comes to Guillain-Barré syndrome, GBS, there's an unknown etiology. It could be caused, however, by a respiratory or gastrointestinal viral or bacterial infection. Surgery could be a cause, viral immunizations, and other viral illnesses. However, in 60% of the cases, is the Campylobacter jejuni bacteria is identified as a risk factor. All right, next, Karen will take the next slide. Thank you.
Hi, this is Karen Dalton. I created the slides and organizations along with some of the artwork. I will also be presenting manifestations of multiple sclerosis and Guillain-Barré syndrome. Multiple sclerosis is a disorder of the central nervous system. This affects the visual field, causing blurring, fogginess, haze, diplopia, and decreased visual acuity. There are brainstem lesions from cranial nerves 3 through 12 that cause nystagmus, dysarthria, deafness, vertigo, vomiting, tinnitus, and facial weakness. It also results in cognitive dysfunctions, affecting concentration, short-term memory, word finding, and planning, as well as mood alterations, which manifest as depression. Additionally, multiple sclerosis results in weakness and numbness in one or both of the extremities, which is usually the legs. There are upper motor neuron involvement that manifests as stiffness, slowness, and weakness or spastic paresis, as well as bladder dysfunction, including urgency, hesitancy, incontinence, and bowel and sexual dysfunction.
Guillain-Barré syndrome has some similar manifestations to multiple sclerosis, but with Guillain-Barré being a peripheral nervous system disorder, the manifestations are somewhat different. There is an acute onset of flaccid paralysis accompanied by paresthesias and numbness. The muscle and sensory nerves and cranial nerves are commonly affected. Initially, symmetric weakness in lower extremities, then weakness and sensory loss ascends to upper extremities, the torso, and cranial nerves. This causes severe pain, paresthesia, numbness. While cognition and level of consciousness are not affected, the facial nerve involvement results in the inability to change facial expressions and close the eyes. Additionally, respiratory function may be altered due to paralysis of the intercostal and diaphragmatic muscles, leading to ventilator support. Fluctuating blood pressure, cardiac dysrhythmias, tachycardia, paralytic ileus, SIADH, urinary retention are also common manifestations. The weakness caused by Guillain-Barré plateaus around 4 weeks, and then strength improves over the following weeks and months.
This is Kelly Flanagan, and I will be presenting the complications of MS and Guillain-Barré syndrome. MS is different for each person, which makes it hard to predict. Most people have an initial attack followed by an almost full recovery. Another attack can reoccur weeks, months, or even years later, followed by yet another period of a relief of symptoms. This is known as relapsing remitting MS. Primary progressive MS is known to be a gradual physical decline with no known remission. However, some symptoms may be relieved temporarily. This type of MS has later onset, typically after age 40, and occurs in both men and women. Secondary progressive MS starts with a relapsing remitting course, followed by a later primary progressive course. The majority of individuals with severe relapsing remitting MS will develop this if they do not seek treatment for this disease. There are also some rare and unusual variations of MS. Marburg variant MS, also known as malignant MS, is one of these. It causes a swift and persistent decline, resulting in significant disability or even death shortly after disease onset. Another variation is Bellow's concentric sclerosis. It causes concentric rings of demyelination that can be seen on an MRI and progresses rapidly. It is important to determine the type of MS that is present because the current disease has many modifying drugs that have been shown to be beneficial for the relapsing remitting types of MS. Finally, an exacerbation, also known as a relapse, is a worsening of MS symptoms or new symptoms that last for at least 24 hours. These relapses are thought to be associated with the development of new damage to new areas in the brain. These exacerbations are characteristics of relapsing remitting MS. These attacks can be mild or they can be severe, which will interfere with the person's daily activities. These exacerbations last from several days to several weeks and have also been known to last for several months. When the symptoms of the attack decreases, an individual with MS is known to be in remission. However, MRI data has shown that this is somewhat misleading because MS lesions continue to appear during these remission periods. Patients do not experience symptoms during remission because the inflammation may not be severe or it may occur in areas of the brain that do not produce obvious symptoms. Research suggests that only about 1 out of every 10 MS lesions is perceived by a person with MS. Therefore, MRI examination plays a very important role in establishing the diagnosis, deciding when the disease should be treated, and determining whether treatments work effectively or not. It has also been a valuable tool to test whether an experimental new therapy is effective at reducing exacerbations. Guillain-Barré syndrome can be devastating to most people because of how sudden, rapid, and unexpected of the onset of weakness. It can also lead to paralysis. However, 70% of people with this disorder eventually recover fully. Those who experience intensive care and recover from successful treatment of infection, autonomic dysfunction, and respiratory failure will typically survive. Typically, weakness occurs days to 4 weeks after symptoms initially occur. Symptoms will then stabilize for days, weeks, or sometimes even months. Recovery can be slow or incomplete. Recovery can last as little as a few weeks up to a few years. Some patients experiencing ongoing improvement after 2 years. 30% of patients with this disorder have weakness after 3 years. About 3% of patients can suffer relapse of muscle weakness as well as tingling sensations years later after the initial attack. 15% of those who experience long-term weakness may require the use of a walker, wheelchair, or ankle support as muscle strength may never return fully. patient may experience ongoing fatigue, pain, and other sensations that they may find to be annoying or troublesome. It is important to handle fatigue by pacing out activities and allowing for time to rest. Patients may also experience emotional stress, as it is difficult for patients to adjust to paralysis and depending on others for help with activities of daily living. Some patients may need psychological counseling or may participate in support groups to help with the emotional stress.
My name is Brittany Harriger, and I will be presenting the therapeutic holistic collaborative care for both multiple sclerosis and Guillain-Barré syndrome. Multiple sclerosis, because it is an autoimmune disorder that does attack the CNS, there really is no cure for the disease. Basically, treatment involves slowing the progression of the disease. So treatment typically that's provided is medications, and medications are typically to again help slow progression and to decrease the attacks of MS. Different types of medications that a person would use are a combination of ACTH and glucocorticoids. These help decrease inflammation and suppress the immune system, which again is because this is an autoimmune disorder. So basically the immune system is attacking the CNS. So that is why glucocorticoids would be appropriate. Interferons and glatiramer acetate, these help reduce exacerbations in patients relapsing and remitting from multiple sclerosis. These medications, they're used to treat specific manifestations such as anticholinergics for bladder spasticity. Another treatment, if medication isn't working, is surgery, and it's indicated for those who suffer from severe spasticity and deformity. Moving forward, you have nutrition and fluids. So the ability to prepare food and eat can be compromised because of the changes in the muscle tone, tremor, weakness, and ataxia. So people have difficulties with basically their ADLs in general. So providing proper nutrition and fluids is important, because for those that aren't able to do those things for themselves, they're going to need a little bit extra care and help with that. Rehabilitation is another treatment that can be provided. And it's basically to help the individuals retain as much independence as possible. And they do this by maintaining and increasing the existing muscle strength that's left. A lot of different types of therapy that's provided is speech therapy, occupational therapy, even maybe even physical therapy, but urologists and respiratory therapists are also involved. Guillain-Barré syndrome is it's an immunological disorder, and just like MS, there really is no cure for it. So treatments typically that are involved with the syndrome are for prophylaxis purposes, and they're basically provided to help fight current issues. So, for example, medications that would be prescribed to a patient with Guillain-Barré syndrome is antibiotics if they are experiencing UTIs or respiratory infections, morphine if they are having muscle pain, anticoagulants. This is especially important because with Guillain-Barré, you're going to have your extremities, you're going to have weakness in your extremities. So you're going to have the anticoagulants for DVT and pulmonary embolism, and that's typically associated with a prolonged bed rest. And then you're going to have vasopressors for your hypotension. Surgery is another form of care that can be provided, and it typically is, again, to help deal with secondary issues that are caused from the Guillain-Barré syndrome, and that includes, getting a tracheostomy done for the respiratory issues that can be involved, or having a pacemaker put in for bradycardia. Another popular form of treatment is the plasmapheresis, and that is when the antibodies are removed and immunosuppressive agents are administered concurrently. People that have this done, they have about 5 exchanges during an 8 to 10 day period. Nutrition and fluids is extremely important as well, just like in multiple sclerosis. For Guillain-Barré syndrome, it's mostly done for, to maintain that positive nitrogen balance, adequate fluid intake and electrolyte balance, and also just to make sure they're getting that proper caloric intake. People with Guillain-Barré syndrome may have issues with swallowing, so whether it's the muscles in their esophagus, in their throat, whatever it may be, you don't want those patients to aspirate and cause more issues. So TPN might be indicated for people who have swallowing issues. Physical and occupational therapy can also be provided, and this is just to prevent complications and to help with the limiting effects of immobility. Therapy also includes continued attention to pain control because paresthesia and pain can interfere with PT.
This is Zach Green, and I will be presenting the psychosocial impact of multiple sclerosis and GBS. So for multiple sclerosis, it can vary depending on the severity of the manifestations of the disease. The goal is to retain as much independence as possible to support the positive self-esteem, self-concept, and socialization. Patients may become overweight due to their inability to ambulate, causing body image disturbances. Patients may have body image changes, altered relationship statuses, and decreased earnings due to the unpredictable course of MS. The disease may require the need for a full-time caregiver that can cause an impact on psychosocial status of the patient. For GBS, the patient may be experiencing a sense of anxiety or powerlessness due to the changes in body function and ability to be independent. Anticipating and managing pain before it becomes severe can decrease levels of anxiety. Include family members in decision-making or care conference to promote a sense of bond among caregivers and patients, and provide the patient with positive reinforcements when they make small gains in their progress.
My name is Daniel Xavier, and I will be presenting community resources. Due to the degenerative nature of these diseases, it is really important that the nurse or caregivers give a really hands-on approach and make sure that these patients really have all the resources that they need to promote that independence as talked about earlier. With multiple sclerosis, the patient may require physical therapy, speech therapy, occupational therapy, even respiratory therapy in order to achieve this. And because urinary incontinence can happen with this disease, they also may be referred to a urologist. So it's just really important to give them the support groups and the therapy groups that they specifically need for their symptoms that they're experiencing. And then you just discuss these treatments with that patient in order to allow them to sort of participate and have control over their situation as much as possible. With GBS, you really want to reinforce teaching regularly and make sure that the patient understands what's required of them in their daily schedule in order to incorporate their therapies. And this can include speech therapy, physical therapy, or occupational therapy, as well as nutritional therapy. And so these therapies really focus on preventing some of the complications that can come with the immobility of GBS. And so it's really important that they understand the importance of it in order to promote independence as much as possible and prolong that independence in life.
This is Karen Dalton. Thank you for taking the time to listen to our video presentation on multiple sclerosis and Guillain-Barré syndrome. And please take the time to explore the concept maps showing how these conditions affect the entire body and different functions. One of the biggest differences you'll see is that with Guillain-Barré, cognition is not affected, whereas with multiple sclerosis, there are dysfunctions of concentration, short-term memory, word finding, and planning. Please take the time to read the rest of the concept maps, and thank you very much from Group 2.